welcome to Youth Diary. Today we have with us Dr. Vinod Padmanabhan from Sudheendra Hospital, Ernakulam. He is an orthopedic surgeon, specializes in arthritis and post-injury treatment. Welcome, doctor.
Hi.
Doctor, what are the common orthopedic problems that our community faces these days?
Nowadays, there are a lot of orthopedic problems affecting the population. The common ones are arthritis, spine-related problems, and then the trauma which leads to injuries, and a lot of sports injuries is also happening nowadays. As the population is getting more and more older, we have a lot of elderly people in our population. So the geriatric problems, that means the problems which affect the elderly people are also on the rise nowadays.
Doctor, we have a query.
Hi, I'm Niranjana from STT-SVN. I have a doubt. What is arthritis and how many types are there?
The word arthritis comes from Greece. Arthritis is, arthro means joint and itis means inflammation. These two words. So it's the inflammation of joint is called arthritis. Now arthritis is a broad spectrum. It ranges from wear and tear of the joints up to inflammatory type of arthritis. But it's usually characterized by pain and swelling and difficulty in walking and difficulty in moving the joints with restriction of movements of the joint. There are many types of arthritis are there. The most common one is osteoarthritis. Osteoarthritis means it's a degenerative joint disorder in which there is wear and tear of the joint. As age progresses, slowly there is wear and tear of the cartilage. Cartilage is the layer between the joints, which helps in giving the cushioning effect to the joint. And with age, as the age advances, arthritis also progresses. Now, apart from age, increased body weight, previous injuries to the joint, or some previous infections, they can all lead to the degenerative disorders, or what we call as osteoarthritis. Apart from osteoarthritis, then there is a group of arthritis called inflammatory arthritis. Inflammatory arthritis includes most commonly rheumatoid arthritis or the ankylosing spondylitis, many types of seronegative arthritis. That means it's all involves the autoimmune kind of disorders. But mainly, broadly, arthritis can be divided as osteoarthritis as well as rheumatoid arthritis. Now, rheumatoid arthritis usually affects little younger individuals. It's little more severe kind of arthritis. Usually affects ladies more than male patients, and it can come as even children can also get affected with. It's called juvenile rheumatoid arthritis. But usually the age group which is more affected is say between 30 to 50 years of age, and it's usually characterized by pain and swelling. It's usually affect the smaller joints of the body, not the large joint. Larger joints can also get affected, but at a later stage. Usually it involves morning stiffness. That means the joints, when the patient gets up in the morning, they feel that all the joints are stiff and there is difficulty in moving the joints. Apart from rheumatoid arthritis, there's still more severe type of arthritis which affect the spine as well as the other joints of the body, which include, that's called ankylosing spondylitis and different types. Treatment of arthritis depends on the stage of the disease. Now, usually the osteoarthritis, it goes through 4 stages. The early stage, in which there is just pain and slight swelling of the joint with mild restriction of activities. But as arthritis progresses, it goes into stage 2, stage 3, where the swelling and pain increases in the joint, and the patient feels more and more difficulty in walking. And apart from the joints, or whichever joint is affected, suppose the shoulder joint, they feel that their activities of daily living are affected. So initial stages of the arthritis can be treated by, say, pain medication, physiotherapy, lifestyle modification. I think that's very, very important. Lifestyle modification includes weight reduction, regular exercises, and that all helps in preventing extra loading of the joint, and that way it prevents arthritis. So this is regarding the treatment of arthritis.
So doctor, is there any need for surgery in advanced arthritis?
Definitely. When arthritis crosses a stage, when it crosses stage 3 and reaches stage 4, that means the advanced arthritis stage, definitely then the only treatment option is surgery. Now surgery depends on which stage, Suppose early stages, that means around stage 3, where the joint is not completely damaged, you can still do some correction of the alignment. Suppose there is a deformity of the joint, you can do the deformity correction and still the joint can be salvaged. But once it reaches a stage when the complete joint is damaged, then the only option available is what we call as joint replacement surgery, also called as arthroplasty. It's usually done for knees, hips, and even for shoulders also.
Doctor, we have another query.
Hi, I'm Nazir. I'm a student of SGTSVN and I want to know what are the common type of injuries you come across in the hospital.
Now many variety of injuries which come to the hospital, but the most common type of cause of injury which comes to the hospital is road traffic accident, which still is quite common in India. Though in the Western population, road traffic accidents are coming down, but in India still road traffic accident is one of the reason for major morbidity, and it's a major killer also, especially in the younger age group. Type of injuries because of road traffic accident, it can be as simple as a small wounds, and it can even lead to some big injuries like spine trauma, spine injuries, or the head injuries, all what we call as polytrauma. Apart from road traffic accidents, the other types of injuries which we come across are sports injuries, which is again on the rise. A lot of people are taking to sports. Then comes the old age injuries, also called as the geriatric population. They have what we call as the osteoporotic fractures, and also the household injuries, the common household injuries, which it varies from, say, a simple injury to the toe, sometimes a slip and fall in the house, which can lead to even sprains and strains of the joint. So different type of injuries we come across in our casualty.